Hi, welcome to another podcast. It's good to see you again. Haven't posted in a while, just been ridiculously busy. Today's podcast is going to be looking at the health equity assessment tool, continuing on from first two videos around co-production, which is preparing for the health equity assessment, and then introducing the health equity assessment tool as well. If you're not sure where they are, then take a look at the channel and you can find those first two. So today we're going to be looking especially at the data and evidence side of the health equity assessment. So in the previous video, if you've not seen that, then clearly it makes sense for you to look at that first. It looked at what your program of work is, what's the problem you're trying to solve. And it spoke about the importance of framing the problem, using things like the decision quality chain to frame the problem, to understand exactly what improvement you're trying to make, what inequalities we're talking about, where are those, where are they lurking, are they inequalities in access, experience, or outcomes, or a combination of all three? So that's what we looked at first. The data and the evidence essentially really is trying to find smoke signals which point to the very inequalities that you are trying to tackle. So there is so many options available when looking at data and evidence for inequalities. The kind of go-to options are around looking at things like your public health data around fingertips, for example. There's local data. If you've commissioned a service, there might be things you can learn about access, experience and outcomes from local data. There may well be information in things like the Joint Strategic Needs Assessment, which looks at the different layers and dynamics of health inequalities in respect of things like employment, housing, and other things that are pertinent to a local health economy. That are all, in that sense, the JSNA, just Joint Strategic Needs Assessment, is looking at the wider determinants of health and wellbeing. Depending on what problem it is you're trying to tackle, there may well be research journals, be they published from the UK or published beyond that. And articles in research journals may help you, may resonate with you in terms of trying to tackle a particular problem. There's national campaign resources as well. So where you've got organisations that might be campaigning for a certain area which is beset with quite chronic levels of inequality, those campaigning groups might have done some work around trying to source data and information to demonstrate where those inequalities are lurking. I suppose an example of that would be if an event has happened, a tragic event is happening, and in response to that, lobbying groups have developed and published papers in response to that tragic event. Keep a lookout for national campaign resources as well. There's the health profiles data as well. There's the inequalities profile data, which is available through the ICB. If you look at other sources as well, such as in the King's Fund, there'll be research papers and journals, and there'll be links to materials around inequalities in other things like the long-term plan in the appendix section as well. So the key thing we're doing is we're asking what data supports your ideas, and what data you're going to use to look at those inequalities to see what change you're going to make. Now, one of the things you might be trying here is you may be trying something quite pioneering, trying something for the first time, piloting something where you believe there to be an area of inequality. You're not quite sure where to find data and information to support that, and actually the improvement you're going to make is going to test something to actually elicit whether or not there is an inequality, and if that's the case, where the inequalities are, and whether your approach that you try actually has a tangible difference on addressing those inequalities. So let's say, for example, you were going to do some targeted work around health checks for people in the community who had recently come from Ukraine to escape the war against Russia. It may well be in your local community this has not been tried before. It may well be that similar things have been tried before, but actually there might be specific nuances that you might want to find out about a particular patient profile, and you've tried, but actually that information is not there. So all is not lost, because in the data and evidence section for the health equity assessment, The beauty is you can declare information that you will be yielding from the very problem you're going to try and tackle. So your program of work may well be doing some scoping work, doing some analysis, speaking to people in different groups, having conversations with people, getting them involved in the co-production, actually undertaking surveys, hosting involvement events, basically creating the conditions where you're going to be a sponge for drawing in as much information as possible that's going to then be used to help inform how you're going to approach tackling an area of inequality. So with the data and evidence section, all is not lost if you can't find something. This is very much about making a commitment to actually be able to find information and intelligence around addressing inequalities. And that's it. Next video is going to be looking at distribution of health. Keep an eye out for that one. And that'll be looking at in terms of socioeconomic factors, how your project or program is applicable to certain groups in the population, like people who are homeless, and then the experience in terms of different protected characteristics as per the Equality in Health Act. So yeah, keep an eye out for that one. I'll publish it as soon as I can. I'll try not to leave it too long this time. I hope you're finding these useful. I find them useful just for the sake of being able to talk to the camera, to unleash, to share things. So in that sense, it's therapeutic for me. So I hope it's helpful for you as well. But yeah, cheers. Take care, and I'll see you soon. Bye bye.